So I think I'd like to commend the government for, um, making it known that one can access post-abortion care at designated facilities within the country. That is very important because unsafe abortions are happening and they are a reality. So that's a good start. We also need to raise awareness on post abortion care, what it is, why it's important, where one can access it, and the possible implications of not accessing it after one has had an unsafe abortion. So the complications involved if you don't, access post abortion care, to your health, implications to your life as well. So I think we continue to, as an organization, make use of our social media platforms, our communities to raise awareness, to educate, and to encourage women to act as referral points, our community champions to act as referral points, whereby they refer community members in need for access to safe abortion, for access to post-abortion care. Thank you. So the possible implications of not accessing post-abortion care can be at different levels. So at the very extreme, someone might even lose their lives. They might die as a result of health complications to their reproductive system, especially if they've used methods that are potentially traumatic. I think we've heard reports of, desperate measures where women have used very, very unthinkable methods like the coat hanger, concoctions, and, depending on the severity of the implications, death is at the extreme. But someone may even have infections. They can have infections from not getting post-abortion care. They can also endure a lot of pain, from that experience, physical pain, for not because they won't be having access to, pain medication. That is also part of the post-abortion care package. Psychosocial support as well. Post-abortion care also encompasses psychosocial support, whereby one is offered professional counseling so that their health, health, when we talk about health, it's not just about physical health, it goes beyond that. And if one has an infection, they have to get, treatment for that infection. So if it's left unchecked, it can develop into something, for example, that can even threaten their fertility, ability to have children in the future. So those are some of the implications.
Thanks so much.
My name is Vimbai Nyika. I'm a programs officer at Women's Action Group. Today we were hosting a training with members of the media from different areas, from Harare, from Tare, as well as Blawayo. And we were discussing issues of sexual and reproductive health rights. In its entirety, also looking at issues of safe abortion here in Zimbabwe, with a specific focus on the law that governs termination of pregnancy, that is called the Termination of Pregnancy Act, put in place in 1977.
Okay, and I understand that there is a need to report abortion methods in Zimbabwe. How best do you advise journalists in Zimbabwe to deal with this?
So sexual and reproductive health rights issues in general, there's a lot of misconceptions that shroud those matters, and the misconceptions stem from limited information and understanding of what sexual and reproductive health rights is, as well as safe abortion. So the first port of call is always to capacitate, read as much content as you can, so that you fully comprehend the subject of SRIHR as well as safe abortion, and you are informed enough to report on those issues. Why is that important? It's very important because there's a human face to these issues, and these are public health issues. So we want, when we are informing the public, we want to get the facts correct. We also want to be sensitive because of the human nature of these issues. We also want to spread information that is verified so that we don't misinform or disinform the public. I think there's been a lot of changes in terms of how SRHI issues are covered by the media. I should say there's been increased interest in even covering SRHI issues, and improved use of language, from the use of stigmatizing language towards sensitive reporting. So I think I applaud members of the media who uh, take it upon themselves to put in that effort, but still a call to action to say, let's read more on the subject, because a lot of changes, are coming through, a lot of evolution, even in our society, that affects even the drivers of safe abortion, uh, and we need to be up to date with what is happening so that we report things that are relevant to our communities, and we share information that is life saving also. For example, sharing information on post abortion care, which is very crucial because given the fact that a lot of unsafe abortions are happening, it's important that we empower communities with life-saving information of where they can go to get assisted, so that their health comes back to the right place.
Okay, and what's your take on what could be the new developments of the TOP Act?
I think the first thing is it's now being discussed at different levels. And I think I commend the civil society space for pushing for these issues to be recognized as worthy of being discussed at public level. In communities, you hear village healthcare workers speaking about SRHI issues. You hear health service providers also talking about them. Even religious and traditional leaders, they're opening up to talk about these issues at parliament level also, which is a good thing because this is a law. We have a law in place, and that means there's also need for accountability, and there's need for us to see if the law is serving its purpose. So a lot of developments have been happening at that level, and I think the increased call to action to say, when the law says someone can access the service, they should be able to do so. We should deal away with the barriers that get in the way of one accessing the service when the law says they can access. The administrative barriers that are time consuming, to the point where maybe one actually ends up, having to carry a pregnancy that they were not ready, or that they were allowed to actually end by law. So, yeah, those are some
Okay,
of the
and maybe
developments.
lastly, can you